So good morning. My name is Sheana Bull, and I am the chair of the Department of Community and Behavioral Health. So I have the honor and privilege of being able to talk about our programs as, I'm sorry, I'm just looking for the clicker. There we go. As the first department. So basically, the order of ceremonies this morning, I'm going to just talk briefly about what our department does and a little bit about who we are. And then I have the honor of introducing three panelists. And so kind of the order of ceremonies, I won't introduce them each individually. I'll introduce them at the end of this presentation. And they'll each take a little bit of time to talk about their work, both research work and applied work in the community. So Betsy Risendal will talk about her work with cancer survivorship. Our community partners from Jefferson County Public Health, Molly Hanson and Marin, will talk about their work in collaboration with some of our students. And then Dr. Jini Puma will talk about a wellness program in preschools. So just a brief overview of our department. We have 62 primary faculty on 3 campuses and 28 PIs conducting research in the school. We have DRPH and MPH programs that are very closely linked to our research. So we try and do a lot of practice-based learning. We have programs in community and behavioral health, maternal and child health, and then recently approved and newly starting programs in global health, and an online program in leadership and public health practice. We have a little over $1 million in direct funds per year, and then a lot of overlap with 3 centers, Center for American Indian Alaska Native Health Cancer Center and the Rocky Mountain Prevention Research Center. So this diagram really represents the 4 areas that we've identified for strategic growth based on the convergence of 3 factors. They represent areas where we have expertise. They're areas identified nationally and internationally as priority areas for public health, and they represent unique opportunities for collaboration in our department. And they do have substantial overlap. So if you fit in one area, you may fit in another, and it's not necessarily so neat and clean. I will make a disclaimer. With 62 faculty and about 8 minutes left in my talk, I don't have time to talk about everybody's research, so the examples I give are intended to be illustrative, and I hope my faculty won't hold me personally responsible if I don't mention them by name. But some examples that we have. In Dean Goff's talk, he talked about the importance of translation, and we firmly believe in community and behavioral health that behavior happens in the context of important environmental and social and societal supports. And we completely agree that systems and social change are needed in order to facilitate healthy behavior. So examples of work in this area include that of Dr. Elaine Belansky, who's working closely in the San Luis Valley with schools in an interesting process called intervention mapping, that allows for dynamic integration of community members in the planning and implementation process of effective behavioral interventions. And she's doing that to address healthy eating and active living in school settings. Marissa Bunning, one of our colleagues in Fort Collins at CSU, is firmly embedded in looking at systems for health behavior change related to food safety. Her work looks at the production, safe handling, and marketing of leafy green vegetables in Colorado. Dr. Ray Browning, also a colleague at CSU in Fort Collins, is looking at the interesting intersection of social networks and obesity prevention by trying to understand where you're positioned in your social network and how you can influence obesity, and has been able to model that if you target slender people who have connections and close ties with people who are obese, they can impact obesity behaviors and healthy eating in the network. Of course, there's a lot of overlap between systems and societal change as well as dissemination and implementation. And from the previous talk, we saw the critical importance of dissemination and implementation to sustain behavior change. So Some of the work I mentioned for Dr. Belansky, Dr. Bunning, Dr. Browning all relate as well to dissemination and implementation. We're working on disseminating good practices through our food systems, through our schools, and through our social networks. My own work focuses on e-health promotion, which is a way to widely disseminate in an unprecedented manner ideas around health promotion and disease prevention. And later this morning, we'll hear from our colleagues from the Jefferson County Public Health Department who have been working closely with our students on implementing best practices that they're learning for community needs assessment to improve health. This actually, the Jefferson County Health Department example that you'll hear about is really just one of many that we've been able to do under the leadership of Dr. Holly Wolf and Judy Baxter in 5 years, who have worked with 9 county health departments and 1 regional alliance to facilitate improvements in community needs assessment. One of our greatest strengths is related to health disparities, and we focus quite a bit on addressing and reducing health disparities in diverse communities. A notable standout is the work of the Centers for American Indian Alaska Native Health, and some examples from that community include work of Dr. Carol Kaufman and working with Dr. Kirsten Black, who work on adolescent well-being, looking at programs to reduce teen childbearing and pregnancy. Dr. Judith Obino, who directs the Center for Native Oral Health Research, whose goal is to reduce disparities in oral health. And then Dr. Angela Brega, who's the program evaluator for the Center of Excellence in Eliminating Disparities for Native Cardiovascular Disease. Dr. Ernest Chavez, another colleague from CSU, focuses on adolescent health and school performance for Mexican American youth, an important factor that is related, school performance being an important factor related to health outcomes. And then lest we think only that racial and ethnic groups suffer disparities, Danny Bertan and Mary Dinger, our colleagues at UNC, focus on an important community, the lesbian, gay, bisexual, and transgender population with their work on physical activity. Of course, again, in the overlap here between health disparities, we see a relationship to mental health as well. For example, Dr. Chavez's work on adolescent health and school performance, he also looks at substance use, which is an important factor in mental health. Jan Beals at the Center for American Indian Alaska Native Health has done important work understanding ways to better measure the prevalence of post-traumatic stress disorder. Kim Henry, a colleague at CSU as well, is looking at adolescent health and the intersection between bullying, victimization, and suicidal ideation. Jen Leiferman here in Denver has focused on maternal wellness, and her work includes efforts to help primary care providers improve their skills in management of maternal depression. We're going to hear in greater detail from Betsy Risendal, whose work in cancer survivorship maps nicely to mental health disparities as well. Overall, our collaborations are community-based. We work in diverse communities from Native Americans and Alaska Natives to rural residents in San Luis Valley and mothers and children across the globe in Guatemala, adolescents in Uganda as well. We have a strong philosophy of engagement with intention and effort to partner and engage with community members in every step of our research process. We have a strong collaborative spirit. We've worked with organizations within the university community as well as partners across the region and the world. They include organizations such as the Colorado Health Outcomes Program, the Children's Colorado in Denver, Denver Health, National Jewish Health, health departments in Boulder, Broomfield, Clear Creek, Pueblo, Eagle, Jefferson, Brent, and Fremont counties. So finally, I'm amazed at how creative our faculty are. This is a tough funding climate. Their can-do spirit has helped them to really pull together and come up with some really creative and interesting ways to continue collaborations to improve the public health of our communities. So now in the next three presentations. We're going to have Dr. Betsy Risendal speak about challenges and advances in cancer survivorship as a public health priority. She'll be followed by our two colleagues from Jefferson County Public Health who are going to mention and describe their efforts working in collaboration with our students to implement a health promotion plan based on a needs assessment. And then Dr. Jini Puma will finish our panel with her description of work to develop a culture of wellness in preschool environments. So I encourage you to welcome them all. Thank you very much.